my name is Hannah Boyd. I was diagnosed with OCD when I was only 16, and because I was only 16 when I was diagnosed, it is considered early onset because it was before the age of 20 that I was diagnosed. There's not anybody currently diagnosed with OCD in my family, but other mental disorders such as bipolar disorder do run in my immediate family, so it makes sense that I would have OCD or some sort of other mental disorder, because immediate relatives of those with mental disorders are at an amplified risk to develop a disorder such as OCD. So because mental disorders do run in my family, it kind of makes sense to me that genes definitely play a role in my developing OCD. However, like, it's not purely genetic because environmental factors also play a big role in the diagnosis. So, I had been living with intrusive thoughts and obsessions for about 6 months before I was diagnosed with OCD when I was 16. Like, when I was younger, I was always pretty particular with cleanliness and organization, but it wasn't until a few years ago that I started fearing that, like, bad things would happen if all of my stuff wasn't in its place exactly. Like, I think that it was triggered initially about the same time that I had to start providing for myself and, like, making my own money, and, like, the first time that I got my own room, because I had shared with my sister before then. I just always kept my stuff spotless, and I was always really anxious when people would touch my things or, like, move them out of their place. Yeah, I just had, like, overwhelming surges, like, that I needed to dust or reorganize stuff that was already organized and already in its place. But, like, living with obsessive compulsive disorder makes my daily life pretty challenging. Logically, I know nothing bad is going to happen because a dish was left in the sink, but I get overwhelming anxiety when it happens, and I have to check. Like, that's where the checking comes in. Like, I have to check. It's an intrusive thought that comes into my head, and I must have left the dish in the sink. So now I have to go make sure I didn't leave a dish in the sink, even though I know that I didn't leave a dish in the sink. You know what I mean? And I won't feel better until I check. And it's not just with dishes, it's with everything. So my anxiety makes it really difficult to dismiss the intrusive thoughts. And I really don't know how to control them, especially when I'm having an anxiety attack. When I was first diagnosed with OCD, I was slightly embarrassed to have to tell people. Like, I was always pretty open about my anxieties, but I was almost ashamed that I got a diagnosis, as if it was, like, a more private situation than just having anxiety. Yeah, like, when my psychiatrist initially told me, I was pretty, like, upset about it, and I was like, what is wrong with me? Like, there's already enough wrong with me. Like, why am I dealing with this? And then she told me steps that I could take to make it better, and just, like, little different things that I could do to help myself. And then there was also, like, the treatment part, which is, like, how to manage the OCD. I received both psychiatric medicine and psychological counseling. I take Zoloft to help decrease my obsessions and compulsions, but it doesn't always suppress it completely. I also go through, like, exposure and response prevention therapy, and it basically, like, repeatedly exposes me to the obsession and prevents me from compulsively responding, pretty much. She gives me, like, homework to complete, homework being not washing my dishes every day or not making my bed every day, or making myself go through that anxiety and knowing that it won't last forever and it'll get better. But yeah, that's my presentation. Thank you.